Professor Hanson, much has been said about the National Health Service, which has been inspirational to many countries. Though I believe that very sturdy edifice is now having some tremors of reform. Now, in terms of the global experience, and particularly crystallized around the National Health Service, how do you think health systems and policy research can guide the global movement towards universal health coverage, and what are the lessons we in India can draw from?
Thank you, Professor Reddy. Well, I was rather intrigued by the first questions we were asked was about these questions around pathways to universal health coverage. And I think that, that one lesson we have learned from health policy and systems research is that those pathways can be very lengthy, as our speakers in the previous session noted. So if I look to some of the early health policy and systems research, for example, research that was done as long ago as the 1980s on the financial burdens of user fees and the effects on impoverishment, that was research was done 20 years ago. And gradually, as it met political movements, for example, the link with the Millennium Development Goals and this political momentum to increase service use, it was able to contribute to a very strong movement to actually remove the user fees that had been introduced, and thereby addressing one of the important elements of universal health coverage, which involves access to services at good levels of quality without financial hardship. So I think sometimes we have to look a long way back to see how policy and systems research is influencing those pathways to universal health coverage. I almost regret making my second point because people have already mentioned Thailand twice, but I'll say something different about Thailand, which Devadasan was talking about the experience of the research in the 1990s that informed universal health coverage. I think the other thing about the Thai experience is that it also started a long way back, and I think provides some quite salutary lessons for countries that are now looking ahead to universal health coverage, and in particular that the supply side strengthening that took place before the expansion of the reduction of demand side barriers was really important. So throughout the 1970s, actually, and the 1980s, there were substantial investments on the supply side in the strengthening of the district health system and the creation of health infrastructure. There was the development early on of a very innovative set of policies to get health workers to locate in rural areas. And that supply side readiness created the conditions in which the universal coverage scheme that was introduced in the early 2000s could be enormously successful. And I think that some of the research that has documented that historical evolution, as in the good health at low cost case studies, is really important, provides some very important lessons for other countries that are looking ahead, because it does take a long time. A third example of where research illuminates some of the challenges of universal health coverage was some work that I saw presented it almost seemed to be coincidentally presented in a session at the Health Economics meetings last summer in Sydney, where some colleagues from the World Bank showed evidence from the Philippines and Vietnam and Indonesia of 3 cases where coverage, so scheme coverage, had increased dramatically. Yet financial protection, so the number of people who were exposed to catastrophic payments, had totally failed to fall. And I think that also illuminates some of the challenges of universal health coverage. So we can't look narrowly at coverage in the sense of population coverage as being sufficient to achieve universal health protection. And in fact, more research is needed to understand why is it that people who are ostensibly covered by a scheme are still not able to access services without substantial out-of-pocket payments. So that's kind of thinking about some of the contributions that research has provided to our understandings of those pathways to universal health coverage. I think there's also a second area I want to just talk about briefly, which is where we need methodological advances in order to continue our path to universal health coverage. And as a visitor to India, I'm awestruck by the size and diversity of India. And I imagine that the sort of complexity of trying to sketch out pathways to universal coverage here is quite substantial. However, it presents a fabulous opportunity, which is to learn from policy experiments that take place in different parts of the country. And in India, there's a rich history of experimentation with different modes of health financing, with models of primary healthcare delivery, with new cadres of health extension workers. And so I think a major challenge for us as researchers is to be able to identify those policy innovations that are working well. So first of all, some questions of evaluation, the sort of what works. But I think more challenging is to think about generalizability and policy transfer. So how can we make informed judgments about whether something that has been successful in one part of the country is likely to be successful in other parts of the country. And now, the issue of policy transfer, it has been explored to some extent, but I think it's an area where we have some fabulous opportunities for methodological development. And I think, if we look at the research on policy, the literature on research transferabilities points us to two ideas. One is applicability. So whether an intervention could be implemented in any settings. Is it actually feasible? And the second they call transferability. So is it likely to be as effective? And so we have to think about what sort of methods we can use to ask those questions. And I think there's a lot of momentum to be gained from using a theory of change approach to asking these questions. We heard yesterday some fabulous stories about how an evaluation of the ASHA system here in India had come up with not just one, but 3 different theories of change, sort of articulating a set of 3 different hypotheses about how it was this particular intervention was supposed to have the effects that it has. And I think that same approach, theories of change and understanding the causal pathway, is enormously promising in helping us think about generalizability and being able to guide us through a structured reflection on how things work, and therefore what are the necessary conditions for an intervention or policy to be able to work in a very different setting. I think that's a real challenge to us as researchers, to be able to make sure that the research we do is as informative as it can be.